Resumption of schools.
Yes.
That's
On
it.
YouTube as well.
Automatically. This one is fine.
YouTube, put it on. Put Facebook on. YouTube, Facebook as well.
Okay. Log out.
No.
I need to log out and in again because she just went live. And then log in.
Are you getting Facebook?
FCC?
Facebook, you are in.
I can't pick you because I'm live with Krishna.
Are you live on YouTube? Okay, how do I find the post?
But you're supposed
No,
to be
I'm
live.
supposed to have the subject that you
Okay,
just.
just say okay and put the Facebook on.
Okay, but it should be 2 minutes now at least.
What is Facebook?
Refresh the title.
Give you on 10 like it.
Okay. 1 minute. Now it says log into YouTube.
Okay, we are in.
Yeah.
Okay, Desire, you have 1 minute 30 seconds now. Okay, but you are live, ne? Okay.
Just refresh the title.
Facebook.
Refresh the title. Bottom. Okay. Go here. Are you connected? This is.
Ronnie, go back to camera 1 quickly.
Go back to the social.
Why is Ronnie passing by?
Social. Okay. 1 minute, 50 seconds, people.
50 seconds. Let's do this when we are live, so that I don't go. Okay. Okay. Turn to your left a bit. Okay. There. When the minister go to the podium, you move that chair out. You see that chair? Ronnie. Ronnie. Yeah. When the minister stand up, you move that chair. The chair, you take it away where it is.
But he must not be
40
passing
seconds.
on the camera.
40 seconds. Ah, God.
Just keep.
Okay, Desire, you are on.
No. He said 40 seconds. They have to count us in. Just give me a black screen.
30 seconds.
Where's the beep coming from?
30 seconds, ne? Krishna?
I hear you, George. Late again.
Countdown. 9, 8, 7, 6. Krishna, rukla. 4, 3, 2, 1. Yes, Krishna.
Yanoa Desire Kahiha, and today's topic we're looking at the resumption of the Namibian school academic calendar with more of a focus on the early childhood development centers. But before we get into that topic, we would like to call on Mr. Ben Nangombe. He is the Executive Director in the Ministry of Health and Social Services. He will be giving us the COVID update for this afternoon. Good afternoon, Mr. Nangombe. How are you?
Good afternoon, moderator. I'm well, thank you very much.
No, we are well. I'm glad to see you in the new year.
Yes, Happy New Year to you.
Thank you.
Yes. I'm giving the COVID-19 update for the 25th of January 2022. And the update is as follows. We announce 83 positive cases from 982 results received in the last 24-hour reporting cycle. This represents a positivity ratio of 8.5%. Out of the total confirmed cases, 78 are new cases and 5 are reinfections. The sex distribution of the confirmed cases is 48 females, of which 46 are new cases, and 35 males, of which 32 are new cases. The age range of these cases is from 3 to 101 years. The cases are distributed nationally as follows. Kunene region, 18 cases, 15 at Korihas and 3 at Opua. Omsati region, 9 cases, Oshikuku 4, Tsandi 3 and Otapi 2. Zambezi region, 8 cases at Katima Mulilo. Oangwena region, 8 cases, 4 at Enana, of which 1 is a reinfection, making it 5, and Engela, 4 cases. Oshana region, 7 cases at Oshakati. Comas region, 6 cases at Venduk, of which 2 are reinfections, making it 8. Kavango East, 6 cases, 4 at Nyangana and 2 at Rundu. Oshikoto region, 5 cases at Omthia. Karas region, 4 cases, or rather Karas region, 5 cases. Luderes 4 and Kiet Manswap 1, and that the other case is a reinfection, making it 2 at Kiet Manswap. Erongo region, 4 cases. Swakopmund has 3. Valfis Bay has 1. Hobabes, 1 case. Kavango West, 1 case at Kurekuru. Ochodonjupa, 1 case at Okakarara. We are reporting cases from 13 regions, with Kunene region recording more cases at 18, constituting 21.7% of the total cases, followed by Omsati and Ohangwena regions with 9 cases each. Among the confirmed cases are 21 learners from different schools, 2 teachers and 1 student, and 4 healthcare workers. 13 cases are fully vaccinated, of which 1 has received a booster dose and 1 did not specify the number of doses received. 69 cases are not vaccinated, accounting for 83.1% of the total confirmed cases. 219 cases from 12 regions have recovered, and the distribution is as follows. Kunene region 60, Omsati 44, Comas 20, Kavango West 18, Hardap 15, Ohangwena 14, Zambezi 12, Erongo 10, Karas and Omaheke region 8 each, Ochodonjupa and Oshikoto region 5 each, making it 219. The number of active cases in the country are now 8,359. 168 cases are currently hospitalized across all regions. 2 of the hospitalized cases have received 1 dose of COVID-19 vaccine. 17 are fully vaccinated, while 149 are not vaccinated, constituting 88.7% of all hospitalized cases. 25 cases are in intensive care, of which 2 of those have been fully vaccinated. We are reporting 13 deaths from 5 districts. They are as follows: Oshakati 5, Oshikuku 3, Onanjokwe 2, Okahao 2, Hobabes 1. One of the deaths occurred on the 3rd of January 2021. 11 deaths occurred between the 19th and the 23rd of January 2022 rather. I must repeat that. One of the deaths occurred on the 3rd of January 2022. 11 occurred between the 19th and the 23rd of January 2022, and 1 occurred on the 24th of January 2022. None of the deceased were vaccinated. By the 24th of January 2022, a total of 480 persons have aged between 18 or from 18 and older have received 1 dose of COVID-19 vaccine, representing 28.2% of the target population, which is 1,471,973. A total of 112,112 persons have received the Johnson & Johnson vaccine, while 243,693 adults have received 2 doses of other types of vaccines. Therefore, 355,805 adults have completed their vaccination, translating to 24.2% of the target population. 3,388 children aged between 12 and 17 have received 1 dose of the Pfizer vaccine, representing 1.1% of the target population, which is 307,298. Of these, 794 are fully vaccinated. Therefore, the cumulative number of persons vaccinated with first dose of COVID-19 vaccine for both children and adults is 418,868, of which 356,599 are fully vaccinated, translating to 20% of the target population, the total target population of 1.7 million people. 14,359 people have received a COVID-19 booster. By way of the national summary, the cumulative number of the confirmed cases are now 155,502. Newly confirmed cases, 78. New reinfections being reported today are 5. The cumulative cases, including the reinfections, are 157,498. The recoveries are 145,187, representing a recovery rate of 93.4%. The active cases currently are 8,359. The cumulative number of the first doses administered for COVID-19 vaccine, 418,868. The cumulative number of the second dose of COVID-19 vaccine administered, 244,487. The cumulative number of the vaccines completed, or rather persons who have completed the vaccine schedule, 356,599. COVID deaths, 3,614 cumulatively. The COVID-related deaths, 323 cumulatively, and the total number of deaths, both COVID deaths and COVID-related, are 3,937. The total samples tested for COVID in Namibia to date, 914,561. The active contacts currently being traced, 1,283. The cumulative number of people to have been quarantined, 86,724. Those discharged from quarantine, 86,498, and the number of people currently in quarantine, 226. That concludes the report for this afternoon. I thank you very much, Moderator.
Thank you very much, Mr. Nangombe. And he has definitely, continued to highlight the fact that COVID-19 is very much still among us, and we can see this from the death rate that is still picking up. So we as Namibians are reminded to do our part to try and mitigate these factors that are causing these deaths, and we are reminded to continuously sanitize. We are reminded to wash our hands with soap and running water, as well as practice the social distancing, which is 1.5 meters that is in place. Now, getting back to the topic for this afternoon, we are looking at the resumption of the Namibian schools academic year calendar for the year 2022. And today we are focusing at early childhood development centers. As I said in the studio today, I have 3 panelists that are going to help us to understand this topic, and maybe, if anything, teach us something new that we did not know. So from my immediate left, we have Ms. Loide Velishavo. She is the Deputy Director for Early Childhood Development in the Ministry of Gender Equality, Poverty Eradication and Social Welfare. Next to her, we have Mr. Eino Haifidi. He is the Senior Education Officer for ECD and Junior Primary in the Directorate of Program Quality Assurance in the Ministry of Education, Arts and Culture. On our far left, we have Ms. Jennifer van Wyk. She is the Manager for the Education Department at Lifeline Childline Namibia. Good afternoon to all of you, and thank you very much for being part of this discussion.
Good afternoon, Lisa.
And thank you for having us.
Thank you very much. And also, you are reminded that you can have some say, you can play a role to be adding your voice to the conversation this afternoon, and our telephone lines through which you can do so. The area code is 061, the number is 400397. The area code is 061, the number is 400397. You can also utilize our social media platforms. That is our Facebook page, and our handle there is the Ministry of Information and Communication Technology in the Republic of Namibia. That is Ministry of Information and Communication Technology in the Republic of Namibia. Our YouTube channel is MICT Namibia. Getting right into things, we would like to ask Ms. van Wyk to assist us. We want to know that as Lifeline Childline Namibia, when it comes to the ECD setup, what is the mandate that you have and the role that you play?
Thank you. We as Lifeline Childline currently, we are implementing various programs in the ECD centers. Our mandate, first of all, is to ensure the social well-being and psychosocial well-being of the Namibian people. Under the ECD, we are currently implementing a program called the School Readiness Initiative that is funded by the Roger Federer Foundation. Through inside this program, we promote, we have a tablet-based course that ECD educators and teachers can make use of to promote learning at home.
Okay, okay. And I'm liking the fact that you guys are promoting it under, you're saying you're promoting the new program? Under the
School
Roger Federer
Readiness
Foundation?
Initiative is sponsored by the Roger Federer Foundation.
It is called the?
School Readiness Initiative.
I'm liking new developments. I love those. Well, education plays a significant role in early childhood development. This is subsequent to health and social well-being of any child, as it has a lasting impact on them all the way through to their adulthood. Now, we would like to know that the Ministry of Gender Equality and Poverty Eradication and Social Welfare, you as a custodian, what policy guidelines have you as a ministry employed for the implementation of the management of childhood development centers to ensure that it is a conducive, or they have conducive environments for children at these centers?
Thank you very much. maybe before I touched much on the policy, let me highlight what is early childhood development does in the life of a child. Early childhood development sets a foundation in the life of childhood, early childhood. Children able to learn, to do what they learn in the during the ECD centers.
Yeah.
ECD center or early childhood development is not only for Ministry of Gender, it's not an isolation responsibility. So it is under 3 ministries. We have Ministry of Gender, yes, Ministry of Education, and Ministry of Health. So each ministry has a responsibility to do in the life of a child. For an example, gender is responsible for early stimulation and early learning, while health is more on health and the nutrition, as well as immunization. So education, I know my colleagues will get into it if time allows. So in 2007, the Ministry of Gender developed the national ICD, we call it National Integrated Early Childhood Development Policy, to guide, as a guide of the holistic development of a child in Namibia. And the policy, we have other guidelines. For example, we have a guideline of Namibia standard, ECD, which set up the minimum standard that we want to see in the country. Okay. We also have the integrated early childhood framework, which is highlighted the activities of the ministries as well as the stakeholders of what is their responsibility when it's coming to the early childhood development in the country. Yes.
Okay, okay. Well placed. Now we at least have knowledge of at least 2, not just 1, but 2, 3 that are in place to assist with this. Mr. Haifidi, the COVID-19 pandemic has repeatedly caused disruption to learning across board when it comes to the education sphere. And in many cases, it has diminished the advancement and progression of ECD. What support does the Ministry of Gender, as well as the Ministry of Education, here you can also answer for the part of the Ministry of Education, have in place to ascertain the continuation of learning and teaching?
Thank you very much for the question. I have to start with my ministry, then my colleague will come in for gender. Since the outbreak of COVID, if I remember well, that was in 2020. So the Ministry of Education has laid out or issued the resilience plan. This plan is in a document of 10 pages, and it's to guide the operations and continuation of the education amidst this pandemic. For example, this includes the rationalization of the syllabus, which was rationalized up to 70%. And it also includes the school-based academic recovery plan. Remember, the resilience plan is bouncing back from challenges. And the mode of attendance are also included in this document. Assessment, learning support, which should be done by all teachers throughout all grades. And then the standard operation procedures are also laid out in this resilience plan. But adding to that, we have also issued a number of circulars to guide the schools' operations amidst this pandemic. And those circulars were issued from 2020 up to the latest one is circular number 1 of this year. And these circulars I'm referring to formal education circulars, and we even have this book which we compiled and disseminated to the regions where all the circulars are compiled. And this book was produced with the financial support from UNICEF.
Okay, is that book available to the public?
Yes.
And where can they find the book?
We have distributed these books in all our educational directorate, in 14 regions. If they can go to the head office or headquarters of the region within their region, they can access this book.
Okay.
And if they can come to the head office of the ministry, government office park, they can get access to this book.
Okay.
But I'm not sure it's just that if it's available online. That I'm not sure. But countrywide, it's available everywhere in each and education directorate.
Okay.
Thank you.
Ms. Lloyd, anything to add with regards to the assertion of the continuation of learning and teaching with regards to ECD?
Yes, with the Ministry of Gender, we also issued the guideline that helps the senders on how they should operate, taking the precautions of all necessary inside the premises, so that they know that children taken care of. As we know that children, the young children, are learned through play. They learn through doing and observation. So we set up the guide that helps the educators, the teachers that provides stimulation to the children, to make sure that children are nurtured on the way that they don't have physical contact when it's coming to play. Also, as a ministry, we also provide, or we procure water tanks to the some of the ECD centers where water is scarce to find, so that we promote the hand washing when it's coming to COVID-19.
Okay.
Yes.
Okay. Thank you. It's good to hear that really efforts have been put in by the two ministries to try and create some form of normalcy, even within this very difficult time that seemingly still does not have an end to it. Getting to Ms. Van Wyk, we would like to find out from you, your organization, what type of psychosocial support does Lifeline Childline render to the educarers at various centers? Remember here, this question is focusing on the person providing the care, not necessarily just the child who's receiving it. What type of psychosocial support do you give?
Thank you very much. Yes, we as Lifeline Childline, we have the 116 and the 106 lines that we promote, that it operates from 8 in the morning, 8 a.m. until 8 p.m. in the afternoon. Educators, as well as the general public, can make use of these lines at any time. But in our work with the ECD centers, we also have a self-guided course within this course during our trainings and our capacity building sessions. We look at the mental health. We tell the ECD educators signs of burnout to watch out for, like some things that could prompt, be aware of any type of stresses. This pandemic is affecting everybody very severely, so we encourage them, as much as you are taking care of the young ones and the parents, also to take care of yourself. We provide face-to-face counseling also that they can access at any time.
Okay. I'm definitely glad to hear that there is such an option, because we tend to neglect the person who is actually doing the service providing, if we can call it that, the one that has to spend, most of their day being highly energetic and positive with these children, to try and also just keep them in good spirits, take care of them and make sure that they're taken care of. We tend to forget about that individual. So I am very glad that Lifeline Childline has that option for these educarers. When it comes to our two ministries representatives that we have in the studio this afternoon, we would like to find out, under which ministry is the establishment of ECD centers? Which ministry bears that responsibility when it comes to the grant foundation establishment thereof? If I want to set up an ECD center today, which ministry do I approach?
Yes, the ECD centers is under Ministry of Gender.
Okay.
And if someone want to set up the ECD center, so we have minimum standards is an allotted area.
Okay.
The ministry set up the minimum standard to follow, to be followed, so that we are sure that whatever will happen within that is taken care of. For an example, the ECD center should be a safe place where children will go learn and be cared of. ECD center should have adequate space because children are learned through play. So each child needs a space. According to our Namibian standard ECD center, which is this one, it indicates that child inside of the classroom need 1.5 square meter. Okay. And a child outside at the playground need 2 square meter. So if you want to set up an ECD center, you have to make sure you have enough space inside the classroom and outside the classroom. And also we have the age groups, because even though we are talking about 0 to 4, we don't put them together. Yeah. We have the age, we categorize them. So when you set up the center, you know, you have appropriate educators that's taking care of this one. 0 to 12 months, and then we have 1 year to 2 years, and then we have 3 years to 4 years. So it's a standard setup. So we also expecting your ECD center to have toilets, safe drinking water. So your center should caring and have the program that stimulating children that will help them once they become adults, they will be responsible citizens of the country.
Okay.
Yes.
And to actually just carry on that particular question, or to piggyback on that particular question, is there an expected standard or characteristic, you know, requirement on the persona, the educator? Are there particular standards or requirements that they're supposed to have, like with regards to their characteristics and uphold? And are there inspectors that go and actually inspect these facilities before they open their doors? Do we have any psycho-evaluation that these educators go through before these people are allowed to start operating?
Yes, the ministry do the assessment. We have to see, once you want to establish, you have to approach the ministry. And we have staff members countrywide. So each region have representatives of Ministry of Gender. So once you want to establish, you go to your region where people knows better the places, where you want to establish your center. They will go and assess to see whether you have a proper facility. You have, because you cannot just say you want to establish and you don't have children. Do you have children available in that area? So that is what we have. We have community liaison officers in the region that do assessment and quantify the go ahead of this center to open. Yes.
Okay. And the psycho-evaluation, anything?
Yes. As I alluded earlier, the standard also elaborating more on the quality of educators to be maybe recruited or to be taking care of these children. They should be, a person should be trained in ECD and should have ability to stimulate children, because with ECD we don't teach, we stimulate. So this person should be able to come up with games, with programs that stimulate children, and we should know children have different needs. So you come up with a program according to the needs of your children, not according to what you want, but according to the needs of the children. So you set up for you to have or to develop or to create
Yes.
a nation with different vision,
Yes.
you should start from the beginning.
Yes, very much.
Yes.
Well, there you have it. You know that you have to have particular standards, and the Ministry of Gender is quite open to provide you with the particular requirements if you have an interest in opening a an ECD, center. We are reminding the nation and whoever it is out there, especially the globe as well, we're reaching the globe as well through our social media platforms. If you want to partake in the conversation this afternoon, you are highly welcome to do so. Our social media platform handles on Facebook, we are at the Ministry of Information and Communication, Ministry of Information and Communication Technology, Republic of Namibia. That is our handle on Facebook. And with the YouTube, we are Ministry of Information, but an abbreviation or our acronym, which is MICT Namibia. That is our YouTube channel handle. So the number to call in, area code is 061. The number is 400-397. Area code 061. 400-397 is the number. So please do give us a call and add your views to the discussion this afternoon. As we said, we're looking at the resumption of the 2022 Namibian academic school calendar with a focus on the early childhood development centers. Getting back to the panelists that we have in the studio this afternoon, Mr. Haifidi, we would like to find out who regulates the school fees at ECD centers in Namibia, and what factors influences the structuring of these fees?
Thank you very much. But as my colleague have indicated here from the Ministry of Gender, that mandate is with the Ministry of Gender.
Okay.
Yeah, so I can refer the question to her.
Okay.
Thank you very much, Mr. Fidi. When it's coming to regulation of fees in ECD centers, we should have in mind that ECD center is still operates in, it's a community-based centers or private.
Yes.
So the ministry is limited to set up the standard fees in ECD centers. So we leave it in the hands of the center management to set up their fees according to the environment.
Yes.
Because ECD center in Okangwati cannot have same amount of fees as ECD center in Commerce.
Yeah.
It should be a difference. So that one we leave it in the hands of the center management. As a ministry, it's a bit tight to have as ECD centers is private and community-based centers.
Okay, okay. I'll get back to that question. I actually have a follow-up question to that one. But we have a caller on the line. We've got Teopoltina, who's calling us from Aranos. Good afternoon, Teopoltina. How are you this afternoon?
I'm doing fine, and how are you?
I am very well. I'm glad that you were able to join us this afternoon. What is your views, your question, your contribution this afternoon?
I just want to ask a question regarding this. Early child development centers. So what requirement do you ask for a person to, or you, let's say, do you give training perhaps before I start my center?
Do you give training to persons who have an interest in?
Exactly.
Come again with that question. Is there provision made for training for somebody who's interested in either working at a early childhood development center or opening one up?
She's willing to open one up.
Okay, if you want to open a center, you are asking if there is training that is given to somebody who's interested in doing that.
Exactly.
Okay, and your other question was?
My other question is, what requirement you ask a person to set up her own center? Do you require having 12 or 10 or go through NACO? So what requirement you
Okay. I do believe that with regards to requirements, Ms. Ms. Velishavo did actually give or hint to what you can do. You can approach one of the offices for the Ministry of Gender. There is a booklet available that actually stipulates all of the requirements that one needs to meet before you open a center, and also the process that you go through to do so. So that is the one answer. The second answer is with regards to the training that you're asking about, whether an individual receives training when they want to open a center. I will allow Ms. Velishavo to answer that one.
Thank you very much. For someone to start up a center, we're expecting this person to have at least a basic of early childhood development. We do induction, not necessarily training as per establishment.
Okay.
But we do induction. So once you approach the office, they will able to take you through of what is requirement, what are the requirements for you to establish. But we don't give training at such point.
Okay.
We do, as a ministry, we do train, yes, but not necessarily once you approach to establish and we train you, because we train according to the list that we have in the ministry under we train according to the educators we have already existing that are not trained. So the one that's joining will be in the list, but not necessarily be trained immediately after establish the center.
So basically there is a system of a waiting list, if we can call it that.
Yes, because we do a survey where we get the information.
Yes.
We know how many educators we have trained, how many do we have that are not trained. So once we got a fund, so then we look at the list that we have. Yes, it's only that the ministry is limited because of resources.
Okay.
Yes.
So Teopotina, to answer your question in a nutshell, does the ministry provide training for somebody who wants to open a ECD center? No, unfortunately not. You would have to actually source funds to get that training at the relevant institutions, such as your UNAM, as your NUSTs and so on, that have majors in these particular trainings. But once you have established your ECT center, through the guidelines that are given by the ministry, as we said, there is a booklet that can allow you to know what your steps are and the necessary processes that you need to go through. Once you have gone through that process and you have established your center, the ministry does an induction for you, and then also they do training once you have been established. But as Ms. Velishavo has been highlighting here, is that there is a list that they first go through. It's like a waiting list system, but it's good to know that they do get to everybody eventually. Yes, you can add something. Yes.
I just want to add that for now, the ministry developed application forms.
Yes.
Because in the past we were not having application form. The person just can come at the office and then from there we take it.
Yes.
So for now we have application forms for the establishment of the center, where you give your intention, why you want to establish your center, and then from there we give you induction, and then you have to submit certain documents, the requirements. And one of them, which is really we want to emphasize, is the police clearance that each and every educator should obtain and should accompany the application. Yes, I know the list is a bit longer, but the forms are available at the regions. Yes.
Thank you very much. Mr. Haifidi, a lot of parents look at ECD centers as places of education, places of learning for their young ones. And in most cases, we tend to approach the Ministry of Education with regards to anything education related. Now, we just want to find out from you, as your role or part in ECD, pardon me, are there any, let's say, information sharing sessions that maybe the ministry organizes to this regard, so that it can maybe help to guide parents with regards to the type of early care and education programs that they can enroll their children into? Or is it just left to the parents to fend for themselves when it comes to this?
Thank you for the question again. But again, I would like to repeat that, as I have indicated, that this mandate is still not with us. It's still with the Ministry of Gender.
Yes.
So, unfortunately, we cannot operate on something which is not within our mandate. Maybe Madam Velishavo can shed light if they do anything in that regard. Or what I would like to comment, maybe partly because ECD is also part of the Ministry of Education pre-primary, is that we don't do any advocacy apart from only through the media, newspapers, especially when you have some journalists who are seeking certain information, or maybe during the result announcement through the media. That's all what we do at the Ministry of Education, but that's mostly focusing on the senior secondary phase. And on the foundation phase, maybe Ms. Velishavo can shed more light pertaining to their mandate.
But before we get to Ms. Velishavo, while we're still with you, you mentioned, and this is also under your mandate, primary education, primary school. Am I correct? When it comes to primary school, because us as parents, we also see that as part of, childhood development, do you then have some information sharing sessions that you do for that level? Because I know that a lot of parents have been going through serious troubles when it comes to either the placement of their children at primary school level and so on. So is there something that maybe your ministry does with regards to that?
Thank you for the follow-up question. Yes, at the national level, we don't do it as such like at the national level for all 14 regions, but there are programs on national radio or local radios where there are always dissemination of this information. And annually, we also run this campaign for admission and inviting parents to start going to the schools and coming to our offices to do registrations for their children. So some of these advocacies are done in the regions.
Okay.
Yeah, mostly like that one I'm referring to my personal experience because I hear.
Yes.
You can hear especially the vernacular radio stations.
Yes.
They run these campaigns with some officials coming from our offices in the region. And maybe before I hand over to Ms. Velishavo, I just want to add on the first question which you asked me about what the ministry have done. So far I mentioned the resilience plan and that we issued a number of circulars to guide the school operations. But the most crucial one is this, that we also made the additional budget in the amount of around 57 million to the regions. And part of this budget, we procured some materials like sanitizers and masks, which we disseminated proportionally to the regions countrywide. And we also made sure that all our schools are having potable water, because we are always talking of washing your hands. So there were schools before COVID came which did not have potable water.
Yeah.
So we made sure that those schools are also provided with water. If I'm not mistaken, 193 schools.
Wow.
Thank you.
Thank you. Ms. Velishavo, on the point that we had earlier on.
Yes, Ministry of Gender do awareness meetings in all 14 regions
Yeah.
on the importance of early childhood development. As I said, we have community relation officers in the regions. They are the ones that organize and conduct this awareness to community members at different levels. This is because early childhood development really was not maybe taken care of. And we want parents to have that understanding, to be able to see that for the child to have that ability, they need to start while they are early. We have a Right Start campaign, which we give information to the parents on behavioral change and also on the development of how the child can develop social, cognitive, emotional, and also physical. We have this campaign that takes place in different social medias. So we have Facebook, we have Instagram, we have Twitter, you talk about YouTube, you also have a television, where normally between the news you find a clip. That is our campaign on the Right Start. And it's under a slogan of make a child step, first step, the right step. Because once you do it right, you do it right.
Yes.
We also do the road show where we have a group goes in the regions, because rural areas, they might not have television, they might not able to access to other social medias, but with this group visiting rural areas, they are able to get message. And we have really, we did a lot. Also, we trained in collaboration with Ministry of Health, we trained also community health workers, because they are more on ground. So when they go in the community, they give this information either to an individual or to the groups. We do awareness, and we want really everyone to have the understanding of why it is important to nurture the child, to stimulate the child at the early age. Because this child in future will be a responsible citizen, and our country will be in peace.
Oh, thank you very much. It's good to know that there is, based on what Ms. Velishavo is saying, that there is actually extensive forms of information sharing to try and guide the parents into, as she said, helping the child to start right and to start early. Ms. Van Wyk, we would like to tackle the issue of bullying. This issue is, unfortunately, it is a reality that is taking place, not just in our communities, because even adults can be bullied, but it is also taking place amongst our little ones in ECD centers and primary schools and high schools and so on. So we would like to find out about that, as in, when it comes to these centers, what are the measures that maybe Lifeline Childline has in place to try and help to mitigate or hopefully even eradicate this problem? But before we do that, we would like to hear from the caller that's on the line. Good afternoon. Hello.
Yes, good afternoon.
Yes, good afternoon. Thank you very much for joining our conversation this afternoon. How are you?
Thank you. Good. How are you?
Very well. Can you start with your name and tell us where you're calling from?
This is Matilda from Omaheke.
Yes.
Now, I don't know, I came here when the discussion was already underway. Maybe it was mentioned, but I would like to know if there's a brochure maybe or a book where one could find information like how many kids should be allocated to one educator, for example, or how big should a room, or how many kids should be in a certain room, or a room of what size?
Okay.
Where can one get such information?
As Ms. Velishava earlier did answer to that. There is a booklet. Let us read to you the title of the booklet that you can receive from any regional, is it regional office for the Ministry of Gender Equality, Poverty Eradication and Social Welfare. The title of the booklet is named Namibian Standards for Early Childhood Development Centers, and that falls under the mandate of that particular ministry. This is how the booklet looks like. So anything and everything that you need to find out, especially regarding the questions that you just asked right now, are in this booklet. I hope we have answered your question, and when you do get a bit of time, you can make a turn at the Ministry of Gender's offices, and they're available countrywide at all their regional offices as well. That was Matilda, and she's calling us from Gobabis, and I trust that we did actually assist to answer your question, and thank you for actually joining the conversation this afternoon. We get back to the question that we had posed to Ms. Van Wyk, and this is with regards to bullying, what Lifeline Childline Namibia has in place to try and mitigate this problem, which is also present at ECD centers, as much as it's part of any other part of life, and hopefully maybe we can use these type of measures to eradicate the problem.
Right, thank you so much for the question. As Lifeline Childline, one of our mandate is child protection. We are very much, we have awareness raising programs that's running in primary schools. We discourage any form of bullying, but we have sensitization and promoting the 116 line, the 116 and the 106, where children, these are toll-free lines, that children, when they feel discomfort or uncomfortable, they can call and talk to a counselor at any time. They don't have to be scared or worried that somebody's listening or what I'm saying is wrong. They have that. And then we also educate learners on positive messaging through our childline radio called Uitani, where children talk about what other children talk about. So the messages that the children are sending out are things that children are experiencing, and the presenters are also children. So like put out as many positive messages with regards to bullying as we can. We also teach self-awareness and coping mechanisms when we go to do outreaches at the school. You will find that at a lot of schools, our 116 and our logos are printed on these walls to help children cope with bullying at school. And we also have self-confidence and self-esteem boosting programs when we do the painting and things at schools.
Okay, so there we have it. Lifeline Childline does actually have a few options that our little ones can consider if they are feeling a bit of distress, or if they're going through this whole bullying that can sometimes cause a child to go timid and not always want to tell their parents about it. They can give Lifeline Childline a call. What are those numbers again?
We have the 116 child helpline and the 106 GBV helpline.
There we have it. Before we wrap up this conversation, Ms. Velishava, we would actually like to find out, COVID has hit for the past 2+ years. And prior to COVID and through COVID, I'm sure every year there's a bit of a summary about the difficulties and the challenges that ECD centers are presenting to your ministry. Can you just give us a brief indication of what are the most common challenges that they face?
Okay, thank you very much. Since COVID-19, the most challenges that ECD centers faced, parents want to withdraw children from the schools, that they may scared of kids being infected. Educators end up having less children. Children can enroll like more numbers at the beginning, but once COVID rises, so you find the number dropped. And then this really put these centers in a way that they are not able to sustain, because they are more depending on the contribution from parents. And once a parent removed or take the child out. So obvious parent doesn't want to continue. So they also faced a challenge of, children, they learn through play. And in this regard, if we have one educator, it's hard for this educator to control the group. So, and they end up recruit the next person, but there's no fund to give to this person. So when it's coming to finance, it's really challenging that most of the ECD centers faced, especially community-based, where most of time parents are not even contributing at all. Yes.
With that one said, it is quite clear that as a parent, it is just fair that you would be concerned about your little one. But as Ms. Velishava said earlier on, that early development is necessary to shape this child's learning process and the stages at which they learn as they grow up. So yes, COVID is real, but as parents we are really reminded that sometimes we need to bear the brunt and take care of our kids and the necessary regulations that are in place as the ECD centers are doing the same to try and ensure the safety of your little ones, because we do realize the importance of their partaking in the programs that are provided by these ECDs. It plays a huge role in how they progress to their primary school level as well as their high school and so forth. With that said, I would like to thank our panelists this afternoon for being here in the studio with us to help us divulge into the topic of the resumption of the Namibian academic calendar for the year 2022, focusing on early childhood development centers. And also to you, we would like to say thank you for tuning in and being part of this discussion. But from myself for this afternoon, Shianwa Desire Kahiha, it is where I say goodbye and wish you a happy day further. Do join us tomorrow at the same time, same place.